Hi, this is Matt McCormick of the Department of Philosophy, California State University, Sacramento. And this is my lecture on inductively strong arguments. It follows our recent discussion on deductively strong arguments. So inductive strength builds on the notion of inductive validity or cogency that we talked about earlier. And the idea here is that an inductively strong argument meets three conditions. First off, it's got to be inductively valid, and we've had some quizzes and lectures and discussions about what that means. It's inductively valid. The person who considers this argument finds all the premises reasonable to believe, and there's one more condition: the argument is not defeated for this person. And we'll talk about what defeat means. It has a particular specific technical meaning in these contexts. So be careful to use it only that way and not others, and I'll explain those in just a moment. So let's get an example of an inductively strong argument. So you probably buy this argument. In most cases, when my textbooks, teachers, professors, and experts say that something's true, it is. My chemistry textbooks, teachers, professors, and experts say that the atomic number of hydrogen is 1. Therefore, it's true that the atomic number of hydrogen is 1. Very simple idea here. The idea is that we've reconstructed an argument that captures more or less why it is you think that the atomic number of hydrogen is 1. It's because people who are experts on this topic believe it, and they've told you that. And it's not to say that we always believe what experts tell us or what our professors tell us. You shouldn't. I'll warn you right now. There's lots of mistakes that I make and lots of others make. But in general, that's where we derive lots of the justification, or a lot of the evidential authority for the things that we believe, because there's far too much out there to know in the world that each one of us could become individual experts on it. We've got to appeal to the people who know better. So look, this is how you figured it out. You read it in a textbook, your teachers told it to you, your professors told you, experts say it's true. And you figure that generally, or in most of the cases, maybe just some slim minority, a majority of the cases, what they say is right, so you accept it. So this argument is inductively valid. The premises, if they were true, would make the conclusion likely to be true. The premises are true, and so you accept the conclusion. It's not defeated. We'll talk about that in just a minute. Okay, here's another example. Most adult men are taller than 5 feet. Matt McCormick is an adult man, therefore Matt McCormick is taller than 5 feet. So you haven't seen me in person, you don't know how tall I am. That picture probably looks like I'm more than 5 feet. I'm pretty normal. In fact, I'm 6'2". So on the basis of simple inductive grounds, you'd accept the conclusion of this argument most likely. All right, so very simple examples just to illustrate how inductive strength works. It's a measure of how compelling is an inductive argument to someone, and a measure of whether or not they accept the conclusion on the basis of the premises. Another simple example: most humans have the bacteria in their stomachs. Barack Obama is a human, therefore Barack Obama has bacteroids in his stomach. Gross but true. Another example: the vast majority of hands of 5 cards dealt from a thoroughly shuffled deck do not make up a royal flush. So if you're looking at somebody across the table from you who had just gotten a hand of 5 cards dealt to them, and they picked it up and held it just looking at it themselves this way, you'd be running the odds this way. It's a 1 in 649,739 chance that that's a royal flush over there. So the odds are very strong in favor of it's not being a royal flush. So if this hand was dealt from a thoroughly shuffled deck, then this hand is probably not a royal flush. That is, you can assume, you can adopt the view, you can accept the conclusion that that's not a royal flush. Now, somebody at this point might say, well, you can't prove anything. You don't know it for sure. Now, in this case, notice that a 1 in 649,000 chance of something's being true is not deductive certainty. We don't know with absolute certainty that that's not a royal flush. It could be. It's just a very, very slim chance. So we don't have absolute certainty in this case, yet it's perfectly reasonable to draw the conclusion that person might have a royal flush, but they most probably don't. And you'd be quite reasonable in thinking they don't have a royal flush. That's the way you'd act in a poker game. It's also reasonable to conclude that you won't be hit by lightning this year. It's a 1 in 500,000 chance, or eaten by sharks, a 1 in 500 million chance. So that's to say, for most things, we have inductive assurance or inductive probability at best. And if someone were to demand deductive certainty for something to be reasonable to believe, then almost everything we believe is unreasonable. So I've alluded to this discussion, I've talked about this in an earlier lecture, but the idea here is that inductive probability, or having a high degree of certainty based on probability, is just fine for most things. In fact, the vast majority of things that you believe, the things you know, the things that the reasonable conclusions you draw, the most you've got is some probability. So the mere fact that something's possibly false is not enough to undermine it or to lead us to be skeptical about it. Anytime it's a greater than 50% chance, that starts tipping the scales in favor of belief. All right, so another example. The vast majority of Americans have not walked on the moon. There are only 12 humans who ever did. Professor McCormick's next-door neighbor is an American. Therefore, Professor McCormick's next-door neighbor has not walked on the moon. Very good odds that that's true. I've seen my neighbor. You haven't seen him, but I'm pretty sure he's not a famous former astronaut. Some of those guys are dead and others don't live in Sacramento. So I've got lots of grounds to believe and lots of grounds to accept this argument. It's not defeated for me. And let's talk about what defeat means. All right, so a defeated inductive argument happens in these kinds of cases. Since inductive arguments do not give us certainty, there can be cases where the premises are true and the conclusion is false. And that brings out this difference between inductive arguments versus deductive arguments. Because remember, in a deductively valid argument, if the premises are true, the conclusion is guaranteed to be true. But with inductive or probabilistic arguments, it does on occasion happen. Unlikely things do occur. People do win the lottery sometimes. Sometimes your background information defeats the inductive conclusion. The argument is cogent, the premises are true, but you know on independent grounds that that particular conclusion happens to be false. So consider this example. The vast majority of Americans have not walked on the moon. There's only been 12 out of 300 million who have. James Irwin is an American. Therefore, James Irwin has not walked on the moon. So the very same arguments we saw before, but in this case, it's defeated by your background information because he is one of the Americans who walked on the moon. There's a picture of him doing it. So you now have some background information that leads you to reject this argument. But notice the premises are still true. James Irwin is an American, and the vast majority of Americans have not walked on the moon, but he's one of the exceptions to the rule. So this is one of those inductive arguments that's peculiar because it's inductively valid. The premises are true, but you should reject the conclusion. So that's what it means to say that an inductive argument is defeated. And we're not going to use defeat in any other circumstances in this course. All right, so what about this one? Dr. Jain examines Mitchell, who has fever, chills, headache, and muscle pain. Usually patients with these symptoms have the flu, Dr. Jain thinks to herself. So Dr. Jain concludes that Mitchell has the flu. Agent Sumner works for the CIA, and she knows that Mitchell, an important weapons expert for the Pentagon, has been infected with Ebola by a Russian spy. You had no idea that your critical thinking class was going to get so exciting. This argument is inductively strong for Dr. Jain, but it's defeated and weak for Agent Sumner. And the idea is that the same argument can have a different status, a different strength status for different people because of this reasonableness issue. So consider the argument. In most cases, patients with fever, chills, headache, and muscle pain have the flu. Mitchell is a patient with fever, chills, headache, and muscle pain. Therefore, Mitchell has the flu. Dr. Jain looks at that, and she doesn't know about the Ebola issue, and those symptoms are of Ebola, but it's far more common when people show up in a doctor's office for them with those symptoms to have the flu. So Dr. Jain just concludes that Mitchell has the flu, but Sumner has this important extra information that leads Sumner leads this argument to be defeated for Sumner. Okay, so different status for two different people. All right, what about this argument? It is possible that taking airborne is an inexpensive, safe means to reduce your chances of getting a cold when you travel on a plane. And you'd like to reduce your chances of getting a cold when traveling on a plane. Therefore, you should take airborne. And now I've tried to capture an argument that's pretty close to the kind of argument that leads people to take this stuff, airborne, or to try something like this. Now, so we're going to continue doing this argument analysis project like the homework assignment that's coming up. So I'm going to ask a series of questions about this one to analyze it. First question, is the argument valid, cogent, or ill-formed? And this one, in fact, is ill-formed. That's partly why I'm separating out these issues. Notice it says it's possible that taking airborne is an inexpensive, safe means to reduce your chances of getting a cold. Well, inductively valid arguments need to say that in the majority of cases, or usually, or typically, or most of the time, or some other kind of probabilistic claim, and the mere possibility that airborne will help you is not enough to make this inductively valid. So this argument is neither deductively valid nor inductively valid, and arguments that are neither valid nor cogent, they're ill-formed. So this one's ill-formed. And that right now, we already know that this argument is going to be weak because if the logical structure is poor, then it's weak. But we'll continue with the questions anyway. Are the premises true, false, or do you suspend judgment? Well, again, as we saw before, this is something of a subjective or personal call. For me, premise 1 and premise 2 strike me as being true. It is possible that taking airborne is a way to reduce your chances of getting a cold when you travel on a plane. I don't think it's true, but it's possible. Furthermore, I guess I would like to reduce my chances of getting a cold when traveling on a plane. Allegedly, there's a higher chance when you travel on a plane. So maybe it's true. I'd always like to reduce my chances. I don't know how much I'm willing to do for that. I'm not willing to spend a lot of money or do a lot of suspicious, poorly reasoned activities in order to achieve it, but maybe. Okay, so 1 and 2 seem true to me. It's ill-formed. So now when we ask this question, is it deductively strong, inductively strong, or weak, we can say this is weak. It's neither deductively strong nor inductively strong or weak. And really it's weak because the argument's ill-formed. And on the homework assignment, I'm going to be asking you to elaborate. Why is it weak? So you're going to say specifically, well, the logical structure here is neither valid nor cogent. It's just a poorly constructed argument. The premises, even if they were true, wouldn't give us any grounds to accept the conclusion. It's just some random claims about airborne, but there's no logical support here. And even worse, I'll undermine this argument even more thoroughly for you. Just a few years ago, in 2008, Airborne used to advertise that they could prevent colds, and here's what happened. A group of people brought a class action lawsuit against them, and they won $23 million because Airborne was making false claims on the box about what it could do. Originally it said that it could boost the immune system, and when people tested that claim or challenged that claim, it didn't hold up. It didn't hold up. There wasn't any scientific evidence for it. So the courts awarded in favor of the people filing the class action lawsuit. In fact, some of my students who were taking my class at the time, I had one student who got upset, and she wrote in and got in on the class action lawsuit, and she got some of her money back for taking Airborne. So see, critical thinking can save you money and save lives. Okay, so some more examples, some more argument analyses. Anne suspects that she may be pregnant, so she gets a home pregnancy test and she takes it. She gets a positive result. The box label reads, in the vast majority of cases, 95%, a positive test result means that you are pregnant. Anne thinks that this statement about the accuracy rate must be true, or they wouldn't have put it on the box. So she considers the evidence this way. She looks at this argument. Most of the time, a positive result on a pregnancy test means that a person's pregnant. I got a positive result on a pregnancy test, therefore I am pregnant. So now the question is, for Anne, is this argument deductively strong, inductively strong, defeated, weak, invalid, valid? Which one of these apply? And when I give you these sorts of questions on the quizzes in Blackboard, in some cases I'm going to ask you to check all that apply, but in these cases for the next few slides, there's just one right answer. And this is going to test your ability to distinguish all these different concepts now. So deductively strong, inductively strong, and so on. What's the status of this argument? Well, okay, so Anne believes premise 1 and believes premise 2, given the context. Now, is the argument valid, cogent, or weak? And it looks like it's cogent. It fits more the cogent argument pattern. So she believes the premises. It's cogent. Is it defeated by any of her information? No, it doesn't look like. So the correct answer for Anne is that this is inductively strong for her, given what that term means. All right, another example. Kate is in the 6th month of her pregnancy. She's seen an ultrasound of her baby. Her stomach is bulging and she can feel the baby kicking. Out of curiosity, she takes a home pregnancy test and she tests negative. The box label says, in 98% of the cases, a negative result means you are not pregnant. So she thinks about the argument put this way. In 98% of the cases, the negative test result means you are not pregnant. I got a negative test result, therefore I'm not pregnant. So now what's the status of this argument for her? Deductively strong, inductively valid, defeated, valid, inductively strong, ill-formed, or what? Well, okay, so is the argument valid, cogent, or ill-formed? It looks like it's cogent. Are the premises true? Yes, 1 and 2 are true, and Kate believes these two premises. It's true that the negative test result means you're not pregnant in 98% of the cases, and it's true she got a negative test result. But so is it inductively valid or inductively strong? Well, no, she's obviously got compelling defeating information here. She knows good and well she's pregnant, so she knows she's in that rare 2% of people who get a false negative. So this argument's defeated for Anne. Okay, so what about this example? Tom is considering a Wikipedia article that says that the population of the US is about 300 million. He knows that sometimes the claims in Wikipedia articles are unreliable. He read an article a couple of weeks ago that said that Mars is the 3rd planet from the Sun, and he's sure that that's false. So he's considering this argument. Some of the claims on Wikipedia are mistaken. The population of the US is approximately 300 million is a claim on Wikipedia. Therefore, the population of the US is approximately 300 million is probably mistaken. So what's the status of this argument for Tom? Is it well-formed, inductively strong, deductively strong, weak, valid, cogent? Which one of these is it? Well, first question is it valid, cogent, or ill-formed? And right now we can see it's ill-formed. It doesn't fit either the deductively valid argument form or an inductively valid argument form. The mere fact in 1 that some of the claims on Wikipedia are mistaken doesn't mean that in 3 the population is that this claim is probably mistaken. Right? Some people get eaten by sharks, but it doesn't follow that you'll probably be eaten by sharks this year. So the mere possibility doesn't lead to probable. That means this argument's going to be weak for Tom if he thinks it through. So what happens when Tom starts to think about the general reliability of Wikipedia and the fact that some of the claims on Wikipedia are mistaken? What conclusion should he draw? And he's got this claim from Wikipedia that says the population of the US is approximately 300 million, and he's acknowledged that some of the claims on Wikipedia are mistaken. So what kind of attitude should he take towards that conclusion now? He knows that some of them are mistaken. It's possible this one's wrong, but in general, should he accept it or reject it? Given that generally, usually, typically, most of the time, Wikipedia claims are true as Tom sees it, and given that they've said this is one of those claims, what attitude should he take? And the way I've set it up and the way we ought to see this now is that Tom has what amounts to an inductively strong argument in favor of accepting this conclusion, so he should believe it. All right, so here's another example, a more complicated example, and again we're sort of dealing with competing sources and how best to decide what's reasonable to believe in different contexts. So suppose Heather is watching Fox News and she hears Glenn Beck say the White House has proposed forcing abortions and putting sterilants in the drinking water to control the population. One of the sort of zingers, the outrageous sorts of claims that Glenn Beck is given to saying on the air. It's why he's gotten so infamous. All right, so she considers a study that she read about in the Tampa Bay Times recently that said that 60% of the statements made by Fox News hosts, pundits, or guests are flat out false. The Tampa Bay Times study seems more reliable to her than Glenn Beck. Okay, so here's one of these examples, and we're all in this situation, right? There's far, far more things out there in the world that we've got to learn about or know about than we can possibly become experts on ourselves. So we end up having to evaluate the reliability of different experts and trying to decide which ones to believe. So she's got Glenn Beck saying one thing, and she's got the Tampa Bay Times having done a study about the general source where information comes from Fox News. And what the Tampa Bay Times is saying is that most of the stuff coming from Fox News is false. Now, as I've set it up, Heather thinks that the Tampa Bay Times study is more reliable or more believable than the alternative. So now, what is the status of this argument? 60% of the statements in Fox News are false. Glenn Beck stated that the White House has proposed forced abortions and population controls with additions to the water on Fox News. Therefore, Glenn Beck's statement about the White House is false. So for Heather, because of her attitude towards one and her attitude towards two, what is the status of this argument for her? Is it deductively strong, inductively strong, defeated, weak, invalid, or valid? Well, the argument's cogent as we've set it up. It says most A's are B's, X is an A, therefore X is a B. And she believes the premises. It doesn't appear to be defeated by anything that's going on here, so it's inductively strong. Okay, so let's summarize what we've considered so far. Inductively strong arguments have these three features. They're cogent, that is, the premises, if they were true, would make the conclusion likely to be true. You do find the premises reasonable to believe. Now, that's going to vary from person to person depending on their source and their information, who they're talking to, and what the other things they believe. But if you find them to be reasonable, then we're on their way. One of the conditions is met for being inductively strong. And finally, the argument is not defeated by your background evidence. So you don't have anything extra, anything special in your knowledge set or your background information that leads you to reject the conclusion. So that would make it inductively strong. Arguments with false premises are weak, we've seen. Arguments with premises that you should suspend judgment about are weak. That is to say, they don't convince you of their conclusions. Defeated arguments are weak. Ill-formed arguments are weak. So there's 4 different ways arguments can be weak. And we've also seen, once again, that it's not necessary to have absolute deductive certainty about a conclusion in order to be reasonable in believing it or claiming to know it. All right, so the next thing we're going to do is talk about how to reconstruct arguments and put them into this format that I've been using in these courses, in these